I'll turn to Jordan, who will deliver some overview and closing remarks of the panel before we move on to the Q&A. And I still encourage everybody to share their questions in the Q&A box. Over to you, Jordan.
Thank you, Zara, and I see some excellent questions coming in. So let me make this brief. I just want to turn now to the COP26 agenda specifically, and there are some really critical objectives here on the table to secure net zero by mid-century and keep 1.5 degrees within reach, and to adapt and protect communities and natural habitats to the impact of climate change. So in order to do this, what do we turn to? Well, that is all about finance, mobilizing and unleashing finance. So there's an imperative on the table for particularly developed countries to raise $100 billion annually to address these political objectives. Now that sounds like a lot of money, but as we've seen from our panelists' contributions today, it dwarfs in comparison to the externalities of the health impact of fossil fuel combustion, and also the way in which we are currently subsidizing the use of fossil fuels. And that's even before we start to think about the benefits of tax. So as Lourdes outlined, there are huge direct subsidies. We're paying $468 billion directly to fossil fuels, as well as the externalities that are costing our community and society over around $6 trillion. The low-hanging fruits that we can actually target now are transport, gasoline and diesel, and power, coal, and that can raise over $550 billion a year. Now, the solution here is in numbers, but how do we translate this into effective policy? Well, we need to start by telling a really compelling policy story. So what does that story look like? Well, fossil fuel use, we know, drives air pollution and climate change, and both of which have serious health consequences. Barak has outlined the health impacts, and Nishat has highlighted the fact that now there is a global focus on health driven by the COVID pandemic, amongst other things. So ending fossil fuel subsidies and implementing fossil fuel taxes, we know, curb fossil fuel consumption and production. But the impact of these policies on health has only just been recognized. So Lourdes has outlined some really important insights from the fiscal policy space on the impact of doing so. And we know that by removing fossil fuel subsidies, we could reduce over half the deaths due to air pollution, which is one of the leading causes of the burden disease globally, amongst other things. So we have some really hard-hitting tools that are within our use that can be harnessed, not only for the environment, for health. But fiscal reforms are not without substantial challenges. We've seen that from the health tax space. Odd has outlined some of the challenges, but we have particularly powerful industry and social opposition when it comes to fossil fuels. So the industry related to fossil fuels is huge. Fossil fuel reserves are valued at $39 trillion. And in addition, there's estimated to be another $32 trillion of fixed assets related to propping up that industry. In addition, a quarter of the global stock market and half the global corporate traded bond market are linked to the fossil fuel system too. So it is huge, but it is a system on decline. And we have a particular window of opportunity now to act. And I think we have to go, as we've recognized, beyond the environmental discussion to health. So where next? Well, there's an opportunity to reframe fossil fuel policy as a health initiative that simultaneously combats the negative health impact of air pollution as well as climate change. Now, the policy agenda window is here, but it's complex. And we know that evidence is important, but beyond it, it comes down to politics. And to start with, political action requires palatable policy messaging. So let's shift the focus from not only the environment, but towards people. And we can do that through focusing on health. We know that from our experiences in health tax arena, that health taxes lead not only to a healthier population, but a more productive and wealthier population, which is great for the economy. Health taxes raise revenue, which then, as Odd outlined, can be reinvested in really important public goods. So let's continue the discussion. Let's. I think our panelists have outlaid a really compelling case, and let's look at not only shaping the policy agenda window, but telling this compelling policy story that centres not only the environment but health in the agenda. So I'll hand back over to Zara to facilitate a Q&A session. Over to you.